5th in Palo Alto, California. We're here at the ceremony for the awarding of the Purpose Prize by Civic Ventures. And the following is a recording of recipient Sharon Schindler Rising of the Centering Healthcare Institute.
Idea that pregnant women could learn from each other. It's radical. It's troublemaking. Actually, it is radical. After 27 years as a nurse midwife, Sharon Rising, bringing groups of women together for 2-hour sessions over the course of their pregnancies. Patients and health providers immediately reported improved satisfaction and outcomes for the same price as the traditional model. A recent randomized patient study credited the model called Centering Pregnancy, with a 33% drop in preterm births compared with the traditional system. Please join me in honoring Sharon Schindler Rising.
Well, thank you, Sarah, and thank you, Civic Ventures as well. I too am honored to be in the presence of all of you, and I'm really humbled with all of the really wonderful things that are being done throughout the country. It's energizing and reassuring. And also, thanks to my husband, Ron, who is here and who has been really my right-hand person throughout these years. I'm really honored for being recognized for developing a model of healthcare that's having such a positive effect on the lives of women and children and families. Initially, I designed this group model of care to save myself from a system that wasn't working well. The traditional paradigm of prenatal care provides services in fragmented interactions that are controlled by a provider or a staff person rather than by the patients whose needs the services are meant to address. As the demands on the system increased, the amount of time available for individual encounters decreased. Groups allow for the development of self-care skills, a sense of personal empowerment, and the building of community that is just not possible in the traditional care system. One of our big societal challenges is to change our financial incentives to keep people healthy rather than to treat them when they're sick. Office visits, hospital stays, medicines, treatments, well, all really are focused on curing rather than on prevention. It continues to be a real policy challenge as to how to reorient our healthcare system to reimburse for health rather than for illness care. Well, an encore career for me? Well, yes. The mission of our nonprofit, the Centering Healthcare Institute, is to have this model available to every pregnant woman, and now to all people throughout the life cycle as we develop centering parenting, which is well woman, well baby care, centering diabetes, and well, the list just goes on. Because the design of centering really fits for every population. The bend in the road for me has really kept me energized and focused on the need now for major health policy reform. And as an aside, we have a son who is a pediatrician who is now the health policy advisor for the Connecticut Senate Democrats. We are having some lovely interactions. Every baby that is born full term is a benefit to all of us. And every person who gains an increased sense of empowerment and gets connected to a wider community helps us to move toward world peace and understanding. As one centering participant said, because when you get to know everybody, you get to care about everybody. I feel that we're changing the world one group at a time, and it's a career worth continuing. Thank you.